There's still a lot to be learned in kidney cancer, obviously. I think the three trials that I'd like to highlight as examples are the Nectar trial, the Peloton trial, and the Calithera trial. Why? So let's start with the Calithera trial. The Calithera trial, which is meeting its accrual, is a large randomized trial that compares cabozantinib with or without a glutaminase inhibitor. What we're learning is that metabolic alterations of the Krebs cycle might be important in stimulating growth of cancer cells, and that inhibiting those pathways might add value to existing therapy. So these glutaminase inhibitors, the first of its class, trial called Cantata, is now in clinical trials approaching its 400 patients. It's a randomized trial, and we should be able to see whether metabolic inhibitors, when added to TKIs, augment the benefit of a TKI. Watch out for that trial. Second trial is recognizing that we now are in a world where we have HIF2 inhibitors, and we know that VHL is a dominant factor which drives VEGF and HIF2. So the Peloton drugs, I think it's PT2799, if I'm correct, is a trial that's being combined with a TKI. And again, we're looking for augmented activity along the genetic pathways known to be active in kidney cancer using agents that are very specific and downstream of VHL. And that trial's up and running, and we hope to have those results in the near future. And the third trial is a revisiting of an old drug with a new formulation, and that's the Nectar 214 trial. Phase 1 trial was reported by Nazir Tanir from MD Anderson last year, and it basically is trying to use a prodrug that activates the immune system through an IL-2-like mechanism to revisit IL-2 type activity, which existed 20 plus years ago and did produce durable remissions, but in ways that don't have to be associated with the strong adverse events of high-dose IL-2. That Nectar trial is a large pivotal trial. We're participating in that and look forward to those results. So I think those three areas, immune therapy, novel HIF2 inhibitors, and metabolic inhibitors, still an exciting area in kidney cancer.